40% increase in hospitals in just 24 hours. That's a
really
big
surprising thing is just how quickly the outbreak appears to
refrigerated
have
trucks
exploded.
are now being mobilized as makeshift morgues.
This isn't a dress rehearsal.
The United States is turning a corner in the battle against coronavirus.
COVID-19 has claimed the lives of millions across this world, and for many, these deaths have hit close to home. These are the stories of a few women who have lost their mothers due to COVID, and how their lives have changed forever.
Louisiana, a state that's a true melting pot of cultures. As of April 23, 2021, there is 442 newly reported cases of COVID-19 and over 10,000 COVID-related deaths. When it comes to the vaccination, 32% of the state has received at least one dose of the vaccine. This is the story about Stacy Parker and her mother, Pamela Watts. Stacy, tell us about your mother, Pamela.
Not sure we have enough time. She accomplished so much in her life. She lived a fairly simple life. She just wanted to be a mother and a wife and a friend, but she overcame a lot. She had a rough childhood. She was a widow with a year-old child at 16. And then she met my dad, who adopted me, and had a beautiful life. And, they had a child together, and she just loved her children and her family and her church and her husband. And then when the grandkids came, she just adored them. She felt like any mistake that she made being a young mom, which was totally understandable and forgivable, but when the grandkids came, she was perfection. She was perfection, and she was a perfect mom to me, and friend to me, and she was smart. Biggest heart. Anyone who met her, that's what they commented on. Even in the hospital at the end, she had a respiratory therapist who had only worked with her one day. But then when she was moved to ICU and he saw that she was in ICU, she impacted him. And he says, "Oh, I hated to see her here because she just made an impact on me." And she'd only seen him for one day. No one met my mom and wasn't affected in a positive way.
What do you miss most about your mother?
I want to say her hugs. I want to say our talks. I want to say just her presence, just knowing that if I needed her for anything, like she was just there. I didn't realize how integrated she was in who I am. And I just feel like a piece of me is missing.
What are your thoughts about us having the vaccine on the market now? And do you wish we would have had it sooner?
Oh, I think about that. My dad and I have talked about that. My mom died January 8th of 2021. She was weeks from being able to get this vaccine. We'd been so careful. And to think that just weeks later, it would have made the difference. It would have changed everything. And I when I hear of people getting the vaccine, I don't tell them this, but it's almost like it's a thank you to my mom. Thank you that your children or your friends or your neighbors or your spouse or you are not going to have to go through what my mom and myself and my family's going through.
What was your last moments with your mom?
Of course, it's only been a couple of months, but I remember every single moment. She was in the hospital. She'd been in the hospital for 11 days with COVID and pneumonia. They had told us the day before that she overnight might have to go to ICU and be ventilated. So the night before, we had to kind of say goodbyes. And that was really difficult. But then the next morning we woke up and she didn't have to be moved to ICU. And so we thought, oh, okay, good, And I talked to her that morning. I would thank goodness for FaceTime. Yes. Because like I was able to see her and talk to her, and it was hard for her to talk, but just to see her, And so I'd called her and she said, I made it through the night. And so we thought that was hopeful. And then it wasn't even an hour later that she called and she said, they just told me that they're going to have to move me to ICU and put me on the vent. And I said, Mom, do not let them take you until you can talk to like my brother and dad. Like, let me get them on the phone with you. Tell them, do not take you until we have this one last time to talk to you this morning. And so they did. My brother FaceTimed her. My dad called her. And so everyone had talked to her that needed to talk to her, right? And I FaceTimed her again. I was the last one to talk to her other than her care team. And I wanted to be strong, I wanted to be strong for her because I can only imagine what it must be like to know that you're about to go into an arena that not many have recovered from. And so I wanted to be like, it's okay, Mom, you're going to do it. You're going to get on that vent and that vent is going to breathe for you and your lungs are going to be able to heal. And I wanted to be strong, but I just knew the reality was this was probably the last time I was going to get to talk to my mom. And I just couldn't help it. And I just broke down and was just crying. And I just kept saying, tell me you love me, Mom. Tell me you love me. And she would say, I love you, my baby. And I would say, just tell me again, Mama. Tell me that you love me. And she just kept saying, I love you, my baby. I love you. I love you. And I felt that it was so selfish of me to ask that of her because she was having such a hard time breathing and speaking as it was. But I was like, if she's about to die, I just want to hear it one more time because this is going to be the last time that I hear this.
It's hard to say goodbye. This pandemic has changed the way we pay our respects. No longer do we have large gatherings at a funeral. It's been replaced with a small service or a virtual viewing. It's hard to say goodbye from your computer screen. The state of Texas, with a population of over 29 million, has had over 2.8 million COVID-related cases and over 49,000 deaths. On a 7-day average, there are now more than 3,000 new cases per the CDC. This is the story of Leticia Gonzalez-Leal and her mother, Armania B. Gonzalez. Leticia, tell us about your mom.
Yes, my mom's name is Armenia B. Gonzalez. I say she is because even though my mom is not here with us physically, she is with us in many other ways. She is with us through my sisters, through myself, through my dad, and through her grandbabies. We created a family around us, of a family of friends that became family short after. My mom was always known to include everyone. My mom was always known to be generous to everyone. And that's a legacy that my sisters and I want to carry with us, I want to carry forth, and I want to instill in her grandbabies.
How has dealing with the loss been for you? How are you dealing with this?
Dealing with my mom's loss has been incredibly difficult. It's been a roller coaster of emotions. My mom's passing, my mom's death was very sudden. It was due to COVID in December. She went from being a completely healthy 60-year-old to being gone. So it's been a shock. The online community grief supports have been really helpful. but it's definitely been really hard to deal with her passing in such a sudden manner. So this is a picture of when I was expecting my little one. That's my mom and I, my baby.
In February 2020 till now, the state of Virginia has had over 657,000 reported COVID cases and 10,735 COVID-related deaths as of April 30th, 2021. On a 7-day average, there's been over 1,000 new cases. This is the story of Takesha Carr and her mother, Darlene Kane. Keisha, there is no relationship like a mother-daughter relationship. Tell me about your relationship with your mother, Darlene.
My mother was so much more than just a mom. She was my friend. She was my confidant. She was my business partner. She was so much more than I ever expected her to be.
What type of business did you and your mom have?
We own an event planning business and a catering company. We specialize in Southern cuisine.
What has been the hardest part of losing your mom to this horrible virus?
The reality has been the hardest. Truly, the realization that she's no longer with me. The memories that we have, they're no new memories. Some days, the hardest part is getting out of bed. There's some good days, there's some bad days. But mainly the reality. That's been the toughest part.
What were your last moments like with your mom?
I was at the hospital. My mom had been hospitalized for 2 weeks. Initially, we didn't know what it was. Her first x-ray didn't show COVID. The second x-ray did. She was hospitalized at a local hospital for 3 days. And then they transitioned her to a more skilled unit, an ICU unit. So when they called us on that Saturday, she'd been there for a week and a half. She was on a ventilator and she suffered a stroke to the brain. And the doctors had said there was nothing more they could do for her. When we arrived at the hospital, we weren't able to go into the room with her because she had COVID. So we had to see her through the glass window. And they gave her medicine to sustain her until I was able to get there. And we watched them discontinue the medication and turn her vent off. And from there, she slowly slipped away.
Who was there with you at that time?
My aunt was with me, my mom's sister.
How has life changed since losing your mom?
Tremendously. Everything's changed. From my normal course of the day, I talk to my mom 4 or 5, 10 times a day sometimes. That's changed. I wake up expecting to still see her text message. My phone goes off and I'm thinking it's just her. So everything's changed. The way I go about my day, going back to the business that we shared, that's the hardest.
How are you managing your grief? We know everyone grieves differently. It affects us mentally and oftentimes physically. Be kind to yourself. Not all of us seek therapy. There's power in being able to talk through your grief. California is the largest state next to Texas, with almost 40 million people. The state has had over 3.6 million COVID cases and over 60,000 deaths. On a 7-day average, there's approximately 1,700 new cases of COVID-19.
Hi, my name is Amanda Tafoya. I am the daughter of this awesome woman. Lorraine Tafoya. She's such a stud. My mom passed on January 3rd, 2021, because of COVID. My mom's name, Lorraine, means valiant in battle, and she was big on meanings. And I have to say that she lived up to her name. My mom was an activist. She fought in the March for Cesar Chavez. She stood at Alcatraz. She was an earth shaker. She was the first in her family to get a graduate's degree. I mean, when you talk about an epic person, that was my mom. I spent every day with her. She was my best friend. She was a social worker for 45 years. You can imagine she was a fighter. Being a single parent, I know couldn't have been easy, and she made it so good. She won't get to see my brother and I get married and won't get to see our children. And I think the hardship for me is that they won't get her. She didn't deserve this. I want to thank Bridgett for giving me the opportunity to talk about her. Any chance I get, I do, because she was worth it. So thank you.
Colombia is one of the most beautiful countries in South America. Ana lost her mom in early 2020 when the world didn't know what was going on. In the country of Colombia, over 2.82 million cases. However, there's been 2.6 million people that have recovered, 72,725 deaths as of April 2021. This is the story of Ana Cleary and her mom, Marcela Velasco. Ana, tell us about your mom, Marcela, who is better known as Layla.
Well, my mom, she was one of 8 kids. First of all, we are from Colombia, South America. So it's a huge Colombian family. So I grew up basically with 100 members, close members, between cousins and nephews and sisters-in-law, and I mean, a great family. And she was the last one and the only girl. So she was with 7 brothers, and she was very spoiled. But ever since the beginning, she was very kind and loving and caring. And I think that is what makes her so special.
How has losing your mom affected your family?
It's been a roller coaster, I can say. Because my mom passed a year ago. I am one of the first ones. And I live here in the States with my husband and my kid. Most of my family lives still in Colombia. When she passed, she was in Colombia. But a month before her passing, she was here with me. And I can tell you that it's been that roller coaster from the beginning, that you are like numb and you don't even know what's going on. I was there. We were all there by her side. So you feel the love of everybody. And I think that you don't know what's going on. Then, of course, when I came back, it is that realization that she's never coming back. I was doing all her papers to be here with me as a legal alien. And unfortunately, that's not going to happen. And then with all these COVID situation, so I was basically stuck at home doing homeschooling with my 7-year-old, 6-year-old then, and like not knowing where to go, what to do, what to find. Up to today, everything in Colombia is like frozen because I haven't been able to go back. Hopefully, I'm gonna be able to go back in May. So it's like having those unresolved issues there that unfortunately, until I have them and I have to face them, it's not gonna be also like that tension released. I started being very not so close to my faith because, of course, you start with anger and you ask God why her, why if she was perfectly okay. I lost my dad 20 years ago, so she was basically my rock and the rock of everybody in the family. So it was really, really hard in that sense. So I started like trying to cope with it. I have a kid, so I have to also have a poker face because I have to also be a mom and a teacher and all those things during pandemic, and also a wife. So it's not easy. So I decided just to exercise more, to those moments that I have for myself, try to connect with her in a different way. So it's been, again, like a really roller coaster. Some days are good, some days are not so good. I always remember her. I cry a lot, but I think that is part of dealing with the issue.
What was your last moments like with your mother?
Well, it was very hard. And at the beginning, we didn't even know what was going on. So back in Colombia, I don't think that there was a case yet, like released, because she started deteriorating very fast. So at the beginning, it was a thrombo in her leg, and then the oxygen thing, and then she was wearing a mask, and then the kidneys, and then the liver, and then everything happened like so quickly. And then she was intubated and, of course, sedated. So at that moment, I couldn't like say goodbye to her like in all her senses. But then, of course, I started rubbing her legs and trying to talk about things, and she was like, basically, I think that she was listening to me. And the doctor said, you know what, this is not going to be okay. What do you want to do? So it's a really, really tough decision with my two brothers. And then we said, we have to let her go. So that's the toughest situation. What if we don't? What if? No? So those what ifs. So those 2 days, because she passed on March 3rd, were basically going in and talking to her and being able to connect in a different level. Around, I guess, 6 p.m., when we basically turned off every single thing that was like supporting her. She started flatlining, but then all of a sudden she started again peaking and peaking and peaking. And it was like weird. Then out of the blue, this nurse came into the room, and because I was like worried, what is happening? Is she alive? Is not alive? And basically she whispered in my ear and she said, maybe she needs to say goodbye to somebody. And I was like, oh, my husband, my kid. And then I basically connect with them via FaceTime. And then my brother connected with my nephew and my nieces because they were not able to be in Colombia. And again, the same with my other brother, with the husband. And it was like that moment that it was needed. And then we basically hung up the phones. And I could say that within 5 minutes, she basically literally took her last breath and then the flat line. So it was, in a way, it was like beautiful, I can say, but it was very heartfelt. And then all of a sudden she just opened her hand, and it was like a moment that, okay, now it's a good moment to go. But at least I was able to be with her, and we were all there.
How has your life changed after losing your mother?
I think it's a 180. I think it hits you in every single fiber of yourself. It is like an eye-opening for a lot of different things. It doesn't really matter your creed or your religion or your color of your skin. I mean, because she was that. She was all-inclusive. She was there for it. It's about giving 100% or more. And one thing that it is like a family thing, but it's never, ever give up. So it would be really easy for me right now to give up because I don't have her and I am never going to have her again. But I do have a family and I have myself. So I cannot give up.
Now there are so many variants. It was initially known as COVID-19, then Delta, and now Omicron. We have no idea what's to come, but all we can do is be prepared and stay safe. There's so much opposition to get or not to get vaccinated. We can all agree to disagree. Let's think about the immune-compromised people, the children, and the elderly. Let's have compassion. This is a story about Lakia and Kai and their mother, Miss Ruth C. Arrington. We know that the COVID-19 pandemic has affected so many people in a different way. Tell us about your mom, Ruth.
She was born April 26, 1953, from the country side of Maryland. She's from Southern Maryland. She's a country girl, very proud country girl. She had the best hugs. You know, everyone was her girlfriend. That was her favorite saying. Hey girlfriend.
Oh, I love that.
So she was just a ball of joy and love. I think like with everyone, COVID was this like mystery thing that was like out there, and never knowing, it was out there in the world, never knowing that it would actually hit us and touch our doorstep. Very mild. She had like an earache, which is outside of any of the symptoms they had reported. So my mom had earaches before. So we thought, hey, this is another earache. My sister went and tried to get her
some sweet oil.
Yeah, some sweet oil.
She's from the country.
She just
the country remedy.
all those natural remedies, right? And it just progressed from there. She went to the doctors. They couldn't find anything. They didn't see anything wrong. They just thought it was an earache. So they gave her antibiotics and things like that. And we took her to the doctors. And a couple of days later, she was like feeling better. We were like, oh, okay, this was just an earache. Nothing's wrong. And then that was like a Saturday. And then that Sunday, she started feeling bad again. She was not being able to breathe. Her breathing was labored. She was laying down, she was sweating, all those symptoms. And we had quarantined her because we just didn't know. So we were like checking on her and calling her doctors and keeping them informed. And as of that Wednesday, they said, okay, just bring her in. Took her in. And that was the last time we saw her. She was admitted into the hospital. Her oxygen levels were really, really low. And still not thinking that she wasn't going to come out. I mean, I called my sister. She came up and we sat in a parking lot.
I lost it. When my sister told me that they were admitting her, she was very calm, very confident. I lost it. I'm like, what's wrong with her?
That was a Wednesday. And by Friday, it's not getting better, that we're going to have to put her on a ventilator. And I swear, still, I felt like she was coming home. I just did not think that was going to be it. And from that point forward, for that month, from April 1st to May 1st, as you can imagine, that turmoil of the up and down, the hope, and then the loss of hope, and then a hope, and then the loss of hope. And so that was the most stressful time. Of our lives. I think it was the worst month that we ever experienced.
It was. He basically called us and said, y'all just need to come in. This is the first time we got to see her since she had been admitted. And we're like, this can't be good. She's not looking good. And we went in there and we looked at mom, we cried, we prayed, we told her, we loved her. And like that night, when he's thinking she's going to pass through the night, she came out stronger. Just everybody was just they wanted Ruth to pull through. It's her birthday. We FaceTimed the doctor on her birthday, her final birthday, which we didn't know was going to be her final birthday because she had, again, was making leaps and bounds toward the right direction. Then we got a call on May 1st, like, y'all just need to come in. We prayed. And I remember when we were praying, we were telling mommy, come on, mommy, you've done it before. You can do it again. And my sister felt this sense of peace just kind of like pass over her. She was like, I don't know why I have this peace. And I was like, because she's going to pull through. And the nurse called us and said, come upstairs and be with your mother. Not only
like a second later.
Come upstairs and be with your mother.
I felt the wave of her spirit. And then a second later, the nurse called and said, I need
come
you
upstairs
guys to
and
come
be with
up.
your mother. And I'm like, okay. But we're looking at each other like, what does that mean? And we get to the ICU floor, the COVID unit, and Dr. Holmes was just standing in the hallway against the wall. He looked at us and shook his head. And we just lost it because we knew she was gone. It was just such a, like, she had so many plans, so many hopes, so many dreams. She was with us again, we were just talking about her wanting to start her catering company because she was that good in the kitchen. Like Ruth she went to Master Chef and auditioned. I would encourage her to go, She was
we helped.
We helped everything. Yeah, we did all that. We did everything. We encouraged her, and it's still so surreal. Like, we just can't believe we're even having this conversation with you about her not being here. I'm expecting her to walk in any minute. I'm expecting to hear her come through the door and say, Nanny's home. Yes. So these were actually gifts that were sent to us from a good friend of ours. My mom was everything and then some. I mean, you can't sum up who Ruthie was, but I can tell you that, and then some.
As of April 29, 2021, the state of Georgia overall confirmed cases is 887,827, confirmed deaths over 20,000. On a 7-day average, Georgia has had 908 new COVID cases. This is the story of Rosalind Ashmore and her supportive sister, Betty Phelps Potts, and their mother, Barbara Hurd. Tell us about your mother, Barbara Hurd, better known as Sook.
My mother was the oldest of the family, and she was the backbone. She raised the four of us. It was 2 girls and 2 boys. My mother was the one that really raised us, and she was a good person. Everybody liked her, and when you lose a mom, some people can say, people will tell you that you'll get over it, it's gonna be okay, but until you walk in those shoes, it's one of the hardest things that I have went through.
Talk about how you felt when you found out that your mother tested positive for COVID-19.
I felt really I was so angry. In my mind, I was thinking that my mom have COVID. Oh God, what would happen? So she went in the hospital, and the doctors, they was really good. They let me know everything that was going on, what they was doing and everything. But when he told me that she had pneumonia with the COVID, she couldn't take dialysis because each time they went to give it to her.
It was the 24th of January. The doctors called us and told us we needed to come in. We went in, and that day we got there, her blood pressure was up. And we felt so positive that day. And that was my brother's birthday. And we were like, wow, God worked it out where, we didn't have to say goodbye to our mom on my brother's birthday. Mm-hmm. But it made us feel like, okay, we got a reason to be positive now. So, but, things didn't work out the way we wanted them to work out.
If you can reach out to your mom right now, what would you say?
I would tell her, Mom, I love you and I miss you so much and I wish you were here.
Mom would always go with me. She went with me practically everywhere. And when the COVID came in, it just seemed like Mom, when I would tell her, make sure you put your mask on, wear your mask. And in the beginning, she didn't really want to wear it. She was like, I can't breathe. And I said, well, Mama, you need to wear your mask. She just began to feel some type of way. Yeah.
What were your last moments like with your mom?
Hard. Just brokenhearted.
Yes.
And been brokenhearted ever since.
Yeah.
Because everybody, all the family would always come to Mom's house, and because she just was that type of person, she would just prepare food and want everybody to eat, and she would be the last one to eat.
Yeah.
How has your life changed?
My life has changed because my aunt passed January the 20th, and my mom passed on the 27th.
2 months today.
Yeah, 7 days apart, and it's very lonely, very lonely.
When we think of Nevada, we think of the bright lights of Las Vegas. But there are other cities such as Carson City, Henderson, and Reno. COVID-related cases as of April 2021 are over 300,000 and over 5,000 COVID-related deaths. This is the story of Ashley Street and her mother, Rebecca Joanne Madrid. Ashley, tell us about your mom.
So my mom, Rebecca, that's her name. She was born January 8th, 1970 in Boulder City, Nevada. So she's a local here. It's very, very rare in Las Vegas to be a local. But not only that, she was born in Boulder City to Jimmy Joe Madrid and Mary Jane Lobato. They're natives of New Mexico and Colorado, of Hispanic and Native American descent. So my mom was very, very beautiful, had the dark hair, dark skin, very, very beautiful. She had two siblings, Joseph and Vanessa Madrid. And then she gave me two beautiful sisters, and she had, towards the end of her life, she had 6 beautiful grandchildren.
Tell us about your mom in regards to maybe a very special moment that you might have shared with her.
Yeah, there was a lot of special moments, especially around Halloween time. That was our time as a family. We're not big Christmas people, we like Christmas, but I think Halloween is our special time. She made Halloween special every year. And the Prince, yes, Prince obsession. That's an understatement. It was a huge Prince obsession. I mean, carving on the dashboard of her car of Prince, being 50 years old and still having Prince posters in her room. She married my stepdad. She made it very known that Prince is her real husband. If they want to go forward in their relationship, he has to understand that. And I actually have something special here. When my mom passed away, one of my friends, her mom was a mutual friend with Prince's ex-wife, Maite Garcia, and she reached out and wanted to meet me. So I actually got to meet her a few days after my mom passed, and she gave me this Prince picture. Maite printed it out for us, framed it, gave it to us. We actually had this at my mom's funeral, on her little, table when you go into the funeral. So this is very special to me. I feel like it was my mom. Every time I look at it, I see her. Every time I hear a Prince song, I think of her. So it's very special. Very, very special.
So let's talk about your mom and her last moments. How were those last moments with your mom?
It's just so funny because I'm in the medical field and I know more, but I was more in denial and more like, oh, she'll be okay. Oh, yeah, this is fine. Than my sisters, where they're like, kind of basically pull your head out of your butt. This isn't good. You should know. This is what you do for a living. I was more in denial. But yeah, I took all the phone calls from the nurses. The COVID spread like wildfire. It was New Year's Eve, and my mom and my stepdad went over to his parents' house a few days before that on Christmas. They caught it there, and then when we had that party here, it just spread. Everybody got it. I'm talking my sister, my husband's sisters, their kids, their spouses, my son, my husband. And then, but we didn't know at the time that we had it. My mom got sick first, being overweight, diabetic, that kind of stuff. She got a little sick first, but we thought it was just a little sinus infection. She was prone to get sick a lot. She worked in childcare, so, she was always sick from the kiddos. I took her to my urgent care, and one of my providers there was like, I think it's just a sinus infection. She didn't have any symptoms of COVID. We did IV antibiotics for a couple of days, and she just was getting worse and worse. And, we're like, Mom, this isn't good. I don't know what's going on, but this is not just a sinus infection. I went in her room late at night, and I couldn't get a pulse ox on her. She had no oxygen. Her feet were blue. Her lips were purple. We called 911, and when they got there, her oxygen was 60.
Oh, wow.
Yeah, it's supposed to be over, 90. But when she got there, she was good for about a week. She did have COVID, I really thought she would survive. She would be okay. I mean, she's had 3 small strokes, heart attacks. She's had cervical cancer. Wow. So my mom, she was a trooper. She's a fighter. So I really thought she was going to make it. They were very positive, letting us know that when she came home, there's going to be like respiratory therapy and but towards the end there, she got septic, from the pneumonia, COVID-induced pneumonia. And they gave me a warning that she wasn't going to make it. And she passed in 3 days. And I took all the phone calls. They would call at 3 a.m. just letting you know, your mom's heart can stop any minute now. And that went on for about 3 days. And then they called me that morning. She passed at about 5 a.m. to let me know once again, her heart can stop. Do we want to resuscitate? Yes, of course. And then they called me about 10 a.m. and let me know that she had passed. And her birthday was, a few days before that. So that was really hard. We did better than we thought we would. We all were very, very close to my mom. We really thought we wouldn't survive without her. When she was in the hospital, we're like, oh, if she goes, like, we're not going to make it. We're just not physically, mentally. But you find the strength, and I'm doing okay. I stay very busy with work. I actually got out of the medical field. It was very triggering for me. We have good and bad days. There's no in between. When they're bad days, they're really, really bad. And when they're good, they're so good.
Yeah.
But yeah, no in between where you're like, you know what, I'm okay. It's either, hey, I'm really good, or hey, I'm not good. But it brings us solace and comfort knowing that she's with her grandma and with her dad. Once, her big daddy's girl. She missed him a lot. Also, about 3 days later, 3 days after she passed, her cousin passed from COVID as well.
Dear Mama, it's me again. Never thought I would face each day without you. You taught me so much in my life, and I'm forever grateful. But you didn't teach me how to live without you. It's not easy. From a motherless daughter.
Hi, my name is Renee Peoples, and this is a story about my beautiful mother. Well, my mother's name was, her real name was Gertrude Jones, but she wasn't too fond of that name, so everyone called her Dee. Everybody know her as Dee Jones. This lady was phenomenal. She was a woman in every way possible. My mom died of COVID on March 31st, 2021. The hardest day of my life. I was on the phone with my mother when she took her last breath. She was at home, actually waiting for the ambulance to come. She was diagnosed with COVID on that Sunday. And on that Wednesday, my mom was gone. My mom wasn't sickly. She had high blood pressure, sure. And she had like thyroid issues, sure. But my mom was still working. She will work until she dropped, right? So we didn't think anything of it. We was like, okay, it's felt like a cold to her and she will get over it. Well, she didn't. Anyone who knew her knew that if they came across her, if they were in her presence, that they were going to receive all of the love that they can possibly receive at that time, in that moment. Just to talk about my mental health right now, this happened for me not too long ago. And I didn't know how I was going to get through it. Honestly, I didn't know how I was going to make it. I was so used to my mom being there. I was so used to her presence. I was so used to being able to pick up the phone, call my mom. She's there no matter what. And now that's gone. So I'm trying to deal with it. I'm going to go and I'm going to seek a counselor so that I can try to learn how to deal with the grief. I'm praying for all of those who's lost a parent, a loved one, a friend to this horrible disease. And I'm praying that whoever have to deal with this horrible disease, they get through it. I hope and pray that they get a hold of this disease and eradicate it so that we can go back to some form of normalcy.
The pandemic has affected each of us differently, especially those working on the front line. This is a story about nurse Tammy Rowe
and her mother, Elaine. Tammy, tell us about your story.
So I woke up at like 2 in the afternoon. I got a call from the hospital. Well, I just assumed it was the hospital that I worked for, but it looked at the phone and it was a hospital where my mother lived. They told me that she was really sick. She was septic. They said she was negative for COVID, but a month prior to, she had pneumonia and went to the emergency room, was treated for pneumonia, and they had no ICU beds. So she was in the emergency room for like 4 days on a stretcher, behind a curtain by herself. And I finally was able to speak to the doctor because I was trying to get permission to fly out to California to be with my mother. And they were like, well, no visitors because of COVID, and I'm like, well, I'm a nurse and I really need to, leave. So I was able to get permission to fly out there. She's, deteriorated, over the next couple of days. I spoke with one of the case managers to try to get her transferred out to another hospital. But at that time, in California, all the hospitals were full to the brink. And as a healthcare professional, I felt like my mother didn't get the care that she needed. And I only hope that she had a nurse by her side caring for her and that she wasn't forgotten. Every patient that I took care of, I saw her. And, so there were nights I'd have 5 or 7 patients and the family member would call and want to speak to their loved one. And I would, just make time to stop just so that I could, because that might be the last time they could speak to their loved one. The family members were scared because they couldn't be there. And, we had to be the family members for them. We had to be the support,
Yeah, absolutely. Thank you for sharing that. Talk about how the pandemic has affected you overall when it comes to just the emotions and the feelings of seeing all those individuals dying in the hospital from COVID.
There has to be a little bit of PTSD. It wasn't normal. Like normally pre-COVID days, it's like you came to the hospital to get well and then you left. You know what I'm saying? And then after COVID, it's like you really came to the hospital and not many made it out. I mean, we did have the success stories, but mostly it was disheartening. It was watching patients come in fairly healthy, fairly well, and deteriorate within a matter of 5 days, and they're gone. Like church groups, when I went to Texas, church groups and family members standing outside the hospital with signs, tell my mom I love her, and they would have the names, and they would play the gospel. So it was, we would stand in front of the hospital just sobbing, but we would remember the names and just seeing their faces and knowing how concerned they were, and just couldn't be with their loved ones. That was, I guess, the hardest part for me. And I was at my mom's bedside when she passed. I went to visit her, and she waited until her children came, was her by bedside. We left the hospital. She passed away 10 minutes after we left the hospital. I went back to work the next day, and I worked every day until another 4 months. So I really didn't start grieving my mom's death until 6 months later. Give yourself time to heal. There's no time limit on it. Cry when you need to cry. Remember the happy memory. Look at pictures. Just remember the happy times that you have. And I think it's hard because there's so many of us, so many children that's lost their grandparents. I mean, just the numbers are no time in our lives we know so many people that has lost, loved ones at one time. So just having a support person that you can talk to, and therapy. I mean, I think it's very important even for us as healthcare workers that we need that therapy. We really need to take time out for ourselves and just enjoy our families too, because I mean, life is short. I know it's so cliche, but that's the main thing I took out of this. I've always been adventurous and I've always lived my life, but this pandemic, has really shown me that you really have to live your life. So it wasn't anything that I knew was coming or had planned for. You always think the what ifs, if I would have spent more time, if I had talked to her, my guilt was like, I took this assignment, I could have went out there to help her instead of working, making money. But the reality was I was actually taking this assignment to move her closer to me so I could, help care for her. It just came too late. So I saw so many people die alone or just with, the nursing staff with them holding their hands. So I was so grateful. Fortunately, by the time we got to her, she was unresponsive. But, I knew she knew we were there. But just like I said, the panic of just flying from Houston to California, just, hoping that, she would just be there for us. But it was wonderful spending that last hour with her. We played her favorite music. I held her hand and spoke with her. We FaceTime like her families and friends. And, I knew she was there. So I will my sister actually was not going to come, and I was like, no, you need to come, And so my sister was the last to make it there. Actually, my mom's heart rate when I was in there starting to go down. And I was like, nope, your daughter is on her way. I'm like, you cannot, you cannot, And so, but it was beautiful that, a mother's love that she held on, and so we all was there, and she wanted to make sure we were okay with saying our goodbyes, and it's just ironic, like 10 minutes after we left the hospital, they called us. So I think that was a beautiful gift she gave us. Her song, she said when she was gonna pass, or she wanted her funeral to be played, is Frank Sinatra, I Did It My Way. And ironically, since she's passed, that song will come on like in just the most craziest places, so I think that's, the universal sign that she's let me know that she's there. That's always a universal sign to me that she's present, her spirit is still here, so.
Hey, you. Yeah, you. The one that feels no one understands what you're going through. Your anxiety, your anger. I have news for you. You are not alone. Don't isolate yourself. Look, I know this grief is hard. The pain intensifies on birthdays, and holidays are not the same. Please, don't suffer in silence. Your mom will always be with you. Dr. Green, do you have any words that you can share or recommendations for resources those that are grieving can utilize?
Someone said grief is just misplaced love. So again, I think you should do something that would honor the person that you love in their memory, and that way you will always have them with you in your heart. For resources, there are so many options out here for teletherapy and telehealth now that we can Google a lot of different places to find mental health services for people who are grieving. But one is, of course, my own, Better, BETT-R.life. We are a mobile concierge service where we'll come to you and stay with you anywhere from 7 to 31 days to help you manage your grief. We've partnered with a 24-hour call center, which is First Response Call Solutions. And you can get us there any time of the day or night to speak to a therapist. And we also have an app that we partner with, Addie, A2I.TV. And you can actually chat through there. So all those options are available. We can do chat, video, or phone for you. And that way you can have access to a therapist 24/7.
Thank you for that. So it's very important to get that assistance if you need it. During the pandemic, it is especially hard to grieve and support your loved ones who've experienced a loss. What can we do during this pandemic to support those who are grieving?
I think it's situations like that where we're now in a situation where we cannot attend funerals, we have to do things online or have memorials through drive-bys in the cars and different things like that, that it's important that we do things to celebrate and honor that person. So maybe if they were a flower person or they had a garden, maybe you will build a garden in their honor. Or if they were a person who fed the homeless or something, you'll go out and do something to honor them. This is your way of giving back and remembering that person, but doing something with purpose and meaning that shows love to continue that legacy of that person.
But the first year is probably the hardest when you lose someone, because you don't get a chance to celebrate their birthdays or holidays or special occasions with this person anymore. How can someone push through those tough days?
Again, no one can tell you exactly how to grieve. My suggestion would be that, first of all, you accept it. And honor your feelings, whatever they may be. If you need to cry that day, cry. If you need to scream, scream. Let your emotions be what they are. Accept them for what they are. I think a lot of times we're trying to push them down and turn them around fast for people to, think we're okay, or for us to even believe that we're okay. And that's not necessarily healthy. So let your emotions do what they do, you know what I'm saying? And it's okay in a healthy way, of course. We don't want you to go out and do anything deranged. However, set healthy boundaries for your life. Even though we're separated right now, don't let the phone and social media and TV inundate you if it's too much. It's okay to get quiet. I always say the quiet is so loud that people don't want to be in the quiet. But sometimes that's where you need to be in order to process what you're feeling.
Also, get you a good support system if you can. Maybe just one person. It doesn't have to be a group of people, but one person that you can call and vent, cry, angry, you know, that'll let you have those moments without judging you or reprimanding you for feeling the way you do.
This is the story of Bridgett Ladd and her mother, Janie Curry Conley. Your mother was a huge supporter of you as a producer, director, and a writer, and I know that she is proud of you for what you're doing. What made you decide to do this documentary of motherless daughters?
Because of this woman right here. My mom meant the world to me. And I know she would want me to press through my pain. She would want me to continue to write and create content. And I know that I'm not alone. I know that there's other women that are going through this like I am. I mean, this pain, we got to press through this pain. So I decided to bring some women together that have lost their mothers through COVID and to share our stories. And we've got to heal somehow. And I want us to talk about our mental health as well, because we are battling this daily, but I know there's got to be some strength in our struggles. So I want to make my mom proud. This lady right here.
Hi, I'm Shamir Curry Conley, the daughter of this phenomenal, amazing, beautiful Black woman, Janie Curry Conley. She was definitely phenomenal. She was amazing, wonderful, great, selfless, loving, caring. She was everything. She was a woman of God. She was a great mother, a great daughter, friend, sibling. She was just everything. She was a comedian. She swore she was a comedian. She was so funny. I try to stay as strong as possible for my siblings, for my brothers and my sister. I just want you all to know that COVID is not a joke. And it took my best friend.
Do you know how magical you are? Do you know how powerful you are? Do you know that where you are right now, it's okay? Do you understand that it's okay not to be okay? But you will get through this. You are made from an infinite source. You are fabulous. And everything that you need is already in you and around you. That beautiful mother of yours, she's proud. She's looking at you. She's thankful that you honor her memory by loving on yourself. I affirm for you that this life is yours, that the memories that you have with your mother are for you. Feel your damn feelings. It's okay. Feel everything you feel. It's yours. It's your experience to have. Don't judge yourself. Honor yourself. Honor your truth. Honor your light, because that all came from the infinite source and shine through your mother, and that's why it's with you today. Hi, I'm Kiana Wingfield, and I'm so thankful to be here with you today. Loss is something very, very deep and true, but the one thing I want you to know is that you are not alone. When you speak up and advocate for yourself, you are helping someone else be an advocate for themselves as well. I am the founder of the Intentional Life Club. An Intentional Life Club is a space, a safe space for individuals to come together and focus on their intentions, their gratitude, and affirmations. When you go through an extreme loss, when you lose a parent,
It's insurmountable, the feelings that you feel. No one can tell you how to walk through that, how to feel. It's something that no one can describe for you. So right now, I want to go into an affirmations practice with you all, because affirmations are a powerful source to affirm our existence, to affirm what we want to feel, how we want to engage, and speak life into our day. So I want you to repeat after me. I am an infinite being created from an infinite source. I attest and affirm that my life is purposeful. I attest and affirm that my mother is proud of me. I wake up today and see purpose in my life. I love myself. I am honoring and respecting her legacy. There is beauty in all experiences. I am strong and capable to get through this moment, and I'm thankful for my life experiences. Thank you so much. I hope you feel all the good feels right now. I understand that where you are is unexplainable, but we will get through this together.
We will get through this together. For those that think COVID is just another form of the flu, the pandemic is over, and there is no need to wear a mask, be considerate of those that have lost loved ones, as their lives have changed forever. To everyone that has had a loss, you are not alone. Take care of yourself, meditate, share the memories of your loved ones, and pray and pray.